Hello everyone, I'm Dr. Austin Chiang, and today I want to talk about liver cirrhosis explained. Did you know? There's an organ in your body that performs over 500 vital functions, your liver. The liver is essentially the chemical factory of your body. It detoxifies your blood, stores essential vitamins and minerals, converts food into usable energy, produces bile to help digest fats, makes proteins necessary for blood clotting. But what happens when this powerful organ is pushed beyond its limits? What happens when its remarkable ability to regenerate is compromised? That's where liver cirrhosis begins. About the liver. The liver is located in the upper right side of your abdomen, just beneath the rib cage. It is the largest gland in the human body, weighing about 1.5 kilograms, 3 pounds. The liver is made up of specialized cells called hepatocytes, literally meaning liver cells. These cells are arranged in hexagonal structures called lobules, which are the functional units of the liver. One unique feature of the liver is its blood supply. It receives most of its blood from the portal vein, which carries nutrient-rich blood from the gastrointestinal tract. When the liver is injured, hepatocytes can regenerate and restore normal structure. However, if injury continues over time, scar tissue, known as fibrous tissue, replaces healthy liver tissue. Unlike healthy cells, scar tissue cannot perform liver functions. What is liver cirrhosis? Liver cirrhosis is the end stage of many chronic liver diseases. It does not develop overnight. It occurs gradually after long-term damage. Common causes include long-term alcohol use, hepatitis B, hepatitis C, nonalcoholic fatty liver disease, NAFLD, hemochromatosis, iron overload. Wilson disease, copper accumulation. With repeated injury, the liver attempts to repair itself. Over time, progressive scarring, fibrosis develops. Fibrous bands form. Blood pressure increases in the portal vein, portal hypertension. Bile flow may become blocked, bile stasis. Regenerative nodules form. Eventually, a smooth, healthy liver becomes a hardened organ filled with scar tissue and nodules. Clinical presentation, symptoms. In early stages, cirrhosis may cause no symptoms at all. As the disease progresses, symptoms may include weight loss, fatigue, loss of appetite, enlarged liver, hepatomegaly, abdominal discomfort, jaundice, yellowing of the skin and eyes, severe itching, pruritus. Because the liver metabolizes hormones like estrogen, liver dysfunction can lead to hormonal changes. In men, testicular atrophy, gynecomastia, breast enlargement. In both men and women, palmar erythema, red palms, spider angiomas, small spider-like blood vessels on the skin, serious complications. As portal hypertension worsens, fluid accumulates in the abdomen, ascites. Enlarged veins develop in the esophagus, esophageal varices. Varices can rupture and cause life-threatening bleeding. Since the liver produces clotting proteins, bleeding can be severe. When toxins like ammonia bypass the liver and reach the brain, this leads to hepatic encephalopathy, which can cause confusion, personality changes, slurred speech, tremors, loss of consciousness. If 80–90% of liver function is lost, liver failure can occur. Long-standing cirrhosis also increases the risk of hepatocellular carcinoma, liver cancer. Diagnosis typically includes medical history review, blood tests, liver function tests, ultrasound, CT scan or MRI, liver biopsy, definitive diagnosis. Patients are often referred to a liver specialist known as a hepatologist. Treatment. In most cases, cirrhosis is irreversible. Treatment focuses on managing complications, preventing further progression, treating the underlying cause. Key steps include complete alcohol cessation, treating viral hepatitis, managing hepatic encephalopathy, monitoring for cancer. In advanced cases, liver transplantation may be required. Prevention strategies include limiting alcohol consumption in the UK no more than 14 units per week, practicing safe sex, receiving the hepatitis B vaccine, avoiding shared needles, maintaining a healthy weight to prevent fatty liver disease. Currently, there is no vaccine for hepatitis C. Final thoughts. The liver is incredibly resilient, but it has limits. Liver cirrhosis is a serious, potentially life-threatening condition, but with early detection and proper care, progression can often be slowed or prevented. This discussion is for educational purposes only and not a substitute for medical advice. If you're experiencing symptoms, please consult your healthcare provider. I'm Dr. Austin Chiang. Thanks for watching and stay healthy.